In the National Office, and I'll explain a little bit more about the role of the National Office in a second, we're delighted to be associated and to support today's event and last night's event as well with Elaine and her team. A very strong congratulations to Elaine, Derek and people in Inspire and Reach Out for being innovative and clever around organising today's event. They did all the heavy lifting. They came to us and asked for support, and we tried to, obviously as we do, muscle in on the event, but it's really important for us. I'm the director of the National Office since last Christmas, and our task is to implement the National Strategy on Suicide Prevention. It's called Reach Out. There's a lot of outs in the world of suicide, and Reach Out is our national strategy. It's been in place since about 2005, and it took about 2.5 years, and a number of people in the room I know were involved in putting it together. It's very much a document of its time and was compiled and formed before the web, which is really difficult to imagine, and really had no reference to the potential of IT and technology as a medium in the health services. It's really important for us, and we recognise just how essential and that we recognise the potential of technology as a medium, a positive medium of communication for the wider public in terms of issues around their mental health, but also for people, young people in particular, going through tough times in terms of how we might assist them. In one of my earlier conversations with Minister Lynch, she referred to the importance of communication and in understanding how to communicate effectively, that you know where your audience is and that you address yourself to your audience. So perhaps it's pointless addressing media campaigns or information campaigns at young people just after the 9 o'clock news, because they're not there. Where they are is using their Facebook and using their IT systems. And that's where our audience is. That's where we have to go. Now, we have to do that in a very safe and evidence-based way, and that's critical. As I said, the National Office's role is to oversee the national effort to reduce the level of death by suicide. And communicating with people is key to that. We all are aware that suicide itself is, quite a complex issue and isn't easily understood. Suicide prevention, however, may be more easily understood if we break it down into 2 or 3 component parts. The way I see it and the way I try to explain it to people who aren't in the health service is that it's about help seeking. It's about encouraging people to seek help when they're in distress. Now, people can only really do that effectively if they understand themselves, understand their own sense of wellness, and mental wellness in particular. And that is a big challenge for us. It's a big challenge particularly for men in Western societies, and particularly for men in Ireland. So we need to use all our efforts and use all the mediums available to us, including technology, to access people with a message of hope, but also as a message an educational message, that we help people to understand what their mental health looks like, what it feels like to be mentally well, what it feels like to be mentally unwell or stressed, what the warning signs are, and where to go for help, that there are very clear signposts. Now, there's an increasing bank of international knowledge available to us, that for those at in the highest level of distress, that they may already have made a conscious decision not to ask for help. In that context, our messaging and our campaigns needs to be directed at a broader church, at people who surround people who are in distress, their loved ones, their families, their partners, their spouses, friends, etc. And that they put a blanket around people and they feel confident and comfortable to put their hand on somebody's shoulder and say, I think you're in trouble. Come and get help. The second major block of what we need to do is that when people are distressed, recognise the signs and symptoms and knock at the door and ask for help, that help is there. And that is a challenge in terms of the system. And the extent of the system, the continuum of services, which ranges from self-help opportunities, many of such opportunities are available online, right through to tertiary service, through primary care, specialist support, the support of the community, which is really critical, right through to the mental health service, that it's all joined up and that it's as seamless as we can make it. In terms of our efforts in the past 6 months, we try to join up, spend a lot of time concentrating on joining up the dots around how services might work together to provide supports for people in distress. Behind it all is the requirement to continually test our evidence base of what works. And a lot of the work we do with Inspire and Reach Out and other partner organisations is to test concepts. So for the purposes of today, and I in terms of my own passion for this area of work, I could speak for the morning, but I'm not let. I'm watching here. What we need this morning, and from occasions like today, is to assist us in terms of developing our national roadmap that will guide our campaigns, that will help us organise our services in a seamless way, but which most importantly speaks to people in the community, to people who are in distress, to people who are living with people who are in distress, and that we encourage people to ask help and seek for it, that we reach out. So congratulations, Elaine and team, on the organising today. I would look forward to a very fruitful days of engagement. Our commitment is, for the future, to invest in technology-based services in a way which we haven't been able to do before because we really didn't understand their potential. So thank you and good luck.